Welcome to the Asia and the Pacific Policy Conference 2014, hosted by the Crawford School of Public Policy. I'm here with Yolande Robertson, who's a health advisor with WaterAid Australia. Yolande, we hear a lot about WASH. Can you tell me what WASH is and what it involves?
Sure. So WASH, one of the many public health acronyms or development acronyms, is water, sanitation and hygiene. So that in its most basic form is the provision of safe drinking water, safe sanitation facilities and hygiene, so hygiene behaviours and practices.
Fantastic. So it's not, what's the intersection between that and health?
There are many intersections, and we kind of see WASH as a fundamental sort of, it is fundamental to good health. So having clean water to drink is crucial. You know, we have really high incidences of diarrheal disease in developing countries, and up to 90% of those are caused by poor access to WASH. That's sort of kind of the tip of the iceberg, and that's the go-to that people think about when they think about WASH and health. But beneath that, beneath the surface, we also have a really strong link with nutrition. So there's a condition called, it's a subclinical condition called enteric enteropathy, which is essentially long-term damage to the small intestine. And that reduces the body's ability to absorb nutrients from food. And that over a long period of time can cause stunting. And stunting is how we measure chronic undernutrition, mainly in children, so children under the age of 5. And on top of that, another issue and something that is quite relevant to the Pacific, which is what we've been talking about over the past couple of days, is soil-transmitted helminths, so intestinal worm infections, which are endemic in a lot of settings in the Pacific. So if a child or an adult has intestinal worm infections, they're not getting the nutrients they need from their food, and they're going to have poorer health outcomes as well. And then there's a whole other list that I won't go into for other fecally transmitted infections, so trachoma, polio, hepatitis A and E. It really is a big picture.
So why is a holistic approach so important when it comes to WASH and health?
Often in health, there has been a focus on curative programming and interventions. And while that is really important, we really need to focus on the prevention, and that's where WASH comes in. So ensuring that people have clean water, that they have good sanitation facilities, and they do have good hygiene practices is a really, really strong way of preventing or breaking the cycle of infection with a lot of these diseases.
So looking specifically at the Pacific, what in your view is the biggest challenge to overcoming these issues with WASH and sanitation issues more generally?
It's hard in the Pacific. Water availability, clean water availability is quite an issue in the Pacific. So access to fresh water sources for a lot of these smaller islands and atolls is quite a big challenge. One of the things that wasn't talked about as much over these past 2 days, but is also quite important, is the effect of climate change, of rising temperatures, of rising sea levels and salinity in freshwater supplies. But something I think that is also quite important is the lack of data that we have on the coverage for clean water and sanitation. So we have figures that come from WHO and UNICEF that show that actually access to water and sanitation is quite high across the Pacific. But I think that hides a lot of what is going on within countries. So smaller islands within, say the Solomon Islands, which has hundreds of islands, it's going to be a very different situation in Honiara than it is out in one of the more remote locations.
So the Pacific has the double burden of both undernutrition and overnutrition. Is WASH part of the solution to both of those issues?
Yeah, definitely. Like I said, it's really, really crucial to improve stunting outcomes or to reduce the incidence of stunting in children. That's a big one, and I really think that it's something that can't be forgotten when we're talking about nutrition. There's a lot of focus on non-communicable disease and overweight and overnutrition, but I think the undernutrition is definitely something that we need to focus on, and WASH can play a really big role in that. Similarly with overweight, I spoke in my presentation about the Barker hypothesis, so this idea that undernutrition in a pregnant woman can impact the fetus and actually increase the risk of developing those non-communicable diseases later in life. So hypertension, increased risk for heart disease, abnormal cholesterol levels. So it really is, it's all linked. And I really think that WASH can play a huge role in so many parts of this big picture of nutrition.
Thank you so much for joining us today, Yolande.
Thank you so much for having me.